Good morning. This is the last lecture in the anatomy of thorax, lecture 10. Our objectives first is to describe the anatomy of the thoracic duct, the lymph node and lymphatic vessels of the thorax, the anatomy and relation of the esophagus, the thoracic part of the sympathetic trunk. Thoracic duct, it is in the abdomen. It lies in the abdomen, in the posterior abdominal wall. So it is started in the abdomen as a dilated sac named as cisterna chyli. It is located at the level of the second lumbar vertebra. It is formed by union of the lumbar lymphatic trunk with intestinal lymphatic trunk. So you remember that the thoracic duct, it ascends with aorta. It ascends in the aortic opening in the diaphragm to enter the thorax. It is on the right side of the aorta. It is on the right side of the descending thoracic aorta. Then it runs upward, enter the root of the neck. Here in this region, it bends laterally behind the carotid sheath and just in front of the vertebral vessels. So, it crosses the subclavian artery to enter the left brachiocephalic vein. تفتح بالنهاية بالleft brachiocephalic vein. At the root of the neck, it receives the followings: the left jugular trunk, the subclavian lymphatic trunk, the bronchomediastinal lymph trunk. Although these trunks, they may sometimes drain directly into the adjacent large veins, but also they drain sometimes to the thoracic duct. So, the thoracic duct, it drains the lymphatics from the whole body except the upper right side of the body, which is above the diaphragm. The right upper limb and the region which is above the diaphragm is drained by the right lymphatic duct. ما عدا هاي المنطقة الباقي كله drain into the thoracic duct. So it started as a sac, cisterna chyli sac at level of L2 in the posterior abdominal wall. Ascend upward, enter the root of the neck بالaortic opening طبعا. Enter the root of the neck, bends laterally خلف الكاروتيد sheath, behind the carotid sheath. Right, and it ends that it opens into the left brachiocephalic vein, drain the whole body except the upper right side of the body, which drain directly into the right lymphatic duct. The lymphatics of the thorax, lymph nodes and lymphatic vessels. طبعا هي منطقتين راح نقسمها: thoracic wall and mediastinum. The lymphatic vessels of the skin of the anterior thoracic wall drain into anterior axillary lymph node. But the lymphatic vessels of the skin of the posterior thoracic wall, they drain to the posterior axillary lymph node. So the skin of anterior thoracic wall goes to the anterior axillary lymph node, and lymphatics of the skin of the posterior thoracic wall, they drains to the posterior axillary lymph node. This is superficial. What about the deep lymphatic vessels? The deep lymphatic vessels of the anterior parts of intercostal spaces, they drain to the internal thoracic lymph nodes, which are distributed along the internal thoracic blood vessels. هذه deep structures of the anterior parts of the anterior intercostal spaces. هاي anteriorly deep lymphatics, they goes to the internal thoracic lymph nodes, which are distributed along من اسمها the internal thoracic blood vessels. And the lymphatics, for sure, they goes to the thoracic duct in the left side and the bronchomediastinal trunk on the right side. هاي نهايتها. The deep lymphatics of the posterior, this is for the anterior. What about the posterior? The deep lymphatics of the posterior part of the intercostal spaces, they drained to the posterior intercostal lymph node that lie around the heads of the ribs. Posterior intercostal lymph node around the heads of the ribs. Then إذا بالرايت سايد طبعا above the diaphragm كلها تروح للرايت lymphatic duct, وإذا بالليفت سايد they go to the thoracic duct. The mediastinum, the lymphatic drainage of the mediastinum. احنا طبعا ذكرنا من حكينا بوقت المحاضرات السابقة كل منطقة والليمفاتيك درينج الخاص بها. So there are lymph nodes distributed in the mediastinum, scattered and distributed throughout the mediastinum. So they drain the lymphatics from the mediastinal structures. They ends into bronchomediastinal trunk and thoracic duct. Bronchomediastinal trunk with thoracic duct. So this is the lymphatic drainage for thoracic wall and mediastinum. Superficial or deep lymphatic drainage. The esophagus. The esophagus, it is muscular tube. If you look the side, this pink, this light pink color in the slide is pointed to the esophagus. It is muscular tube. It is 25 centimeter in length. It lies in the midline. Esophagus, it is midline structure, but it tends to incline to the left side as it descends. مع ما إنه ينزل يحاول إنه incline شوية to the left side. It is continuous superiorly with the laryngopharynx at level of C6. So it bears the diaphragm at the beginning. The esophagus is related anteriorly to the trachea and left recurrent laryngeal nerve. You remember that the left recurrent laryngeal nerve descends in a groove between the trachea and esophagus. So anterior to esophagus related to the left recurrent laryngeal nerve and the trachea. It lies on the right side of the aortic arch. If you look to this slide, it is on the right side of aortic arch and descending thoracic aorta. Then, as esophagus, it tends to attain the left position. The aorta, it tends to take midline position. مع ما إنه الإسوفيغاس يحاول أن يميل لللeft side. الأورطة راح يجي tends to be in the midline. زين هكذا ايش راح يصير؟ انه the esophagus it will pass anterior to the thoracic aorta, crossing it at level of T8. This is at the level of T8. The esophagus become anterior to the thoracic aorta at the level and crossing it at the level of T8. تتذكرون, you remember the vagus nerve, also the vagi. The left vagus nerve, it lies anterior to the esophagus. The right vagus, you remember that it lies posterior to the esophagus. And both of them, they share in the esophageal plexus in the lower part of the esophagus. Finally, the esophagus, it runs in the esophageal opening, leaving the thorax. تدخل بالesophageal opening at level of T10, accompanied by, if you remember, the two vagi, the branches of left gastric blood vessels, lymphatics of the lower third. They runs in the esophageal opening at level of T10 to join the stomach. And here, if you look here, there is a fibers, and we talked about this in the diaphragm, that fibers, they come from the right cross of the diaphragm. They run around the esophagus, forming sling-like esophagus, forming like hiatus. Normally, the esophagus has three constrictions. These are anatomic and physiologic constrictions. They are normal constrictions that found in the esophagus. If you look to this slide, the first one is at the level of C6, at the region when the esophagus joins the pharynx. This is the first one at level of C6, 6 cervical vertebra. وإذا ناخذ فد landmark, يعني نقول الupper incisor teeth. إذا أخذنا كلاندمارك الupper incisor teeth, so it is 15 centimeter from the upper incisor teeth. نبدأ من الupper incisor teeth, نعد 15 centimeter. إحنا وصلنا, this is the site of the first constriction of the esophagus at level of C6, at the site where the esophagus joined the pharynx. The second one, it is at the site when the aortic arch and left bronchus crossing the esophagus. So this is the second one, when the aortic arch and left bronchus cross from the upper incisor teeth. The third one is the site where the esophagus passes through the diaphragm into the stomach. مكان قلنا right across ما يعمل هذا السلينج. This is also a site of constriction. Normally, this is about 41 centimeter from the upper incisor teeth. Even 15 centimeter, 25 centimeter, and 41 centimeter from the upper incisor teeth. So these are the normal anatomic and physiologic sites of constrictions in the esophagus. The blood supply of esophagus. To understand the blood supply of esophagus, we will divide it into 3 thirds: the upper third, the middle third, and the lower third. Each one receives blood supply from a different artery. For example, the upper third of the esophagus is supplied by the inferior thyroid artery. The middle third is supplied by the esophageal branches from the bronchial arteries and descending thoracic aorta. The lower third received branches from the left gastric artery. So the upper third from the inferior thyroid artery, the middle third from esophageal branches from the bronchial arteries and descending aorta, and the lower third from the left gastric artery receive branches, esophageal branches from the left gastric artery. And about the veins also the same, نفس الشيء تقريبا. إنه veins are from the upper third, they drain to the inferior thyroid veins, the middle third to the esophagus vein, and the lower third to the left gastric vein. The lymphatic drainage of the esophagus, also to understand it, we will divide it into 3 thirds, the upper third, the middle third, and the lower third. So the lymphatics from the upper third, they drain into the deep cervical lymph node. Deep cervical lymph node. The middle third, they drain into the superior and posterior mediastinal lymph node because it is a posterior structure. Esophagus, it lies in the posterior mediastinum. So the middle third, they drain into superior and posterior mediastinal lymph node. The lower third, they drain into the lymph node and lymphatics along the left gastric blood vessels and celiac lymph nodes. So this is for the upper third deep cervical lymph node, middle third superior and posterior lymph node, and finally drain to the lymphatics around the gastric vessels, gastric blood vessels, and celiac lymph node. Innervation of esophagus, you remember, this is through the esophageal plexus, which carry the sympathetic fibers, comes from the sympathetic trunk, and the parasympathetic fibers that comes from the vagus nerve. It is in the lower part of the esophagus, as I mentioned, around the esophagus, the lower part of the esophagus, as this black arrow pointed. This is the esophageal plexus. The sympathetic trunk. We want to talk about the sympathetic trunk in the thoracic region. أكو sympathetic trunk بالcervical region, thoracic region, lumbar, sacral. كل منطقة راح تاخذوها راح تحكون عن الsympathetic trunk، راح تاخذون فكرة عن الsympathetic trunk in that region. اهتمامنا اليوم هو sympathetic trunk in the thoracic region. Sympathetic trunk in the thoracic region, it is continuous above with the cervical region, with the cervical part of the sympathetic trunk, and below with the lumbar part of the sympathetic trunk. عندنا cervical, عندنا thoracic, عندنا lumbar, عندنا sacral parts of the sympathetic trunk. So, أكثر structure laterally placed in the mediastinum كلش راح يكون lateral, and it runs on the heads of the ribs, lateral and posterior, on the heads of the ribs. And you remember that it leaves the thorax on the side of the body of T12. It runs behind the medial arcuate ligament. The sympathetic trunk اللي بالthoracic region, it consists of 12 ganglia. 12 ganglia. Each one, it has white rami communicants, white and gray rami communicants. كل واحدة بيها white and gray rami communicants, passing to the corresponding spinal nerve, of course. هون عندنا first ganglion. The first ganglion in the thoracic region, the first ganglion of the sympathetic trunk in the thoracic region is fused with the inferior cervical ganglion. يعني أول ganglion بالsympathetic region fused مع الآخر ganglion بالcervical region to form stellate ganglion نسميها stellate ganglion. What are the branches of the sympathetic trunk? First, إيش راح يعطي؟ Gray rami communicants distributed to the all thoracic spinal nerves. طبعاً من thoracic spinal nerves تتوزع على الجسم كله وتغذيه المكانات اللي هي corresponding to. The postganglionic fibers are distributed through branches of the spinal nerves. كلها عن طريق الspinal nerves. وين تروح؟ go to the blood vessels. تعمل مثلا vasoconstriction, vasodilatation، تروح على sweaty glands. مثلا ممكن يزيد السكريشن أو يقل السكريشن. الrector pili muscles of the skin. طبعا كلته تشتغل بالتنسيق مع الباراسمباثيك nervous system. Okay? So the gray rami communicants, they go to the thoracic spinal nerves, to all thoracic spinal nerves. البوست ganglionic fibers مالتها it will go to the blood vessels, sweaty glands distributed طبعا through the fibers of the spinal nerve to supply blood vessels, sweaty gland and erector pili muscles. The upper 5 ganglia, they give post ganglionic fibers. When? To heart, aorta, lungs, esophagus. وذكرنا بكل structure من هذولي تأثير السمباثيتك innervation عليها. كل organ أخذناه وذكرناه regional. فالupper 5 ganglia, they give post ganglionic fibers to heart, aorta, lung and esophagus, the major organs in the mediastinum. The lower 8 ganglia, they give a preganglionic fibers. هذولي يعطون preganglionic fibers who supply the abdominal viscera. They do not supply the structures in the thoracic region. لا, lower 8 ganglia صحيح هي موقعة بالthoracic region, but they supply the abdominal viscera. So the lower 8 ganglia, they give a preganglionic fibers to form the symplectic nerves. And the symplectic nerves, they supply the abdominal viscera. زين. أول واحد هو the greater symplectic nerve. It arises from the 5 to the 9th ganglia. يسمونه greater symplectic nerve. وعندنا lesser symplectic nerve. It arises from the 10th and 11th ganglia. من الجانجليون 10 وال11. يسمونه lesser symplectic nerve. وعندنا الآخر اللي هو lowest symplectic nerve اللي هو it arises from the last ganglia, from the ganglion number 12. إذن lower 8 ganglia, they give a preganglionic fibers. تعطينا great symplectic nerve, lesser symplectic nerve and lowest symplectic nerve. هذولي supply the abdominal viscera, not the thorax. صحيح الجانجليون موقعة بالثوركس، لكن التغذية مالتها الانرفيشن they will supply the abdominal viscera. والgreater symplectic arises from the 5 to the 9th ganglia. تطلع الفايبرز من ال 5 إلى ال 5 وال 6 وال 7 وال 8 وال 9th ganglia كلها تتشارك تعطي فايبرز تعطينا الgreater symplectic nerve. الليسر symplectic nerve it will arises from ganglion رقم 10 وال11 10th and 11th ganglia. وعندنا lowest symplectic nerve it arises from the last ganglion in the thoracic part of the sympathetic trunk اللي هي ganglion number 12. وإذا لاحظنا هذا الرسم this arrow, the black arrow is pointed to the ganglion. This is the sympathetic ganglion. It gives white ramus and gray rami communicants distributed throughout the spinal nerves and supply the viscera. And thank you for today. Thank you for your listening.